In modern dental practices, there are many new and advanced tests and treatments, such as implants and the use of lasers. But the percentage of patients failing to return for maintenance and restorative care has continued to rise over the years. Patients are repeatedly not returning for their non-elective procedures, such as fillings or wisdom teeth extractions, for a number of reasons including rising costs and uncertainty about their diagnosis, treatment, and the lack of provider empathy and/or provider overbearingness. In this video, we are going to discuss how not to and how to confront the uncertainty patients feel about the dental profession. This video encompasses how healthcare affects patients financially, socially, and personally. The patient-provider interaction is set in a dentist office right after an oral exam has been completed. We will be talking to a patient who has never had surgery about the extraction of her wisdom teeth. We feel that the best way to reduce the fear and uncertainty felt by patients, as well as ensure understanding, is to use the teach-back method, which is one of our main objectives of this video. The teach-back method, also called the show-me method, is a communication confirmation method used by healthcare providers to confirm whether a patient or caretaker understands what is being explained to them. When the patient understands, they are able to teach back this information correctly. When using the teach-back method, it is important to recognize that each patient's health literacy is different. Start slowly, consider your approach, consider the situation, use handouts if applicable, and make sure to clarify. We will now view our first interaction between the dentist, dental hygienist, and patient.
Alright, Jill, so we took a look at your x-rays that we have over here, and it looks like you've got 5 cavities this time, which is a lot better than last time since you had like 8 or so last time, but it seems like you have some major cavities this time, and you've also, it looks like your wisdom teeth are impacted, so we're going to have to get those out of there before there's any other problems.
Wait, what are my wisdom teeth? I don't understand how my teeth can be wise. That doesn't make...
They're just your last set of teeth to come in.
But that doesn't make
You'll
any...
be fine.
Well, I can't afford to just get 5 cavities filled and my wisdom teeth taken out. I just got laid off and...
Oh, people do that all the time.
I just spent my whole life savings on Bubba's business. I can't do this.
Okay, well, Jill, I'm going to go ahead and get you set up for those fillings. You won't pay today. We'll just go ahead and send you the bill. We can also set an appointment to extract your wisdom teeth, which I'll just go ahead and schedule for next week.
Next week? I can't even pay my bills. I can't get my teeth out next week. I don't even understand how my teeth are wise. This doesn't even... Wait a minute, guys. This doesn't make any sense. I'm scared to do this. I've never had surgery before.
Oh, you'll be fine.
Well,
kids in high school do this all the time. College kids do this all the time.
I guess so.
All we have to do is pull those suckers out and stitch you up and send you home. You'll be fine.
Stitches?
Yeah. So Kelly, can you get her on the schedule, and we'll get that done next week, and we'll get those fillings done today.
Okay, so I have you set up for surgery next Wednesday, 8 a.m. Now we'll go ahead and get your fillings done.
This was clearly what not to do. The patient was uncertain about what the surgery entailed, how she was going to afford the surgery, and about having to take time off of work without being cleared to. The dentist and the dental hygienist were far from empathetic with the patient's circumstances and did not explain the procedures to the patient. This forcefulness would discourage the patient from speaking up and possibly deter the patient from coming back for continued care, as well as cause her much anxiety over finding a way to pay for these procedures. We will now watch the dentist, dental hygienist, and the patient in the second scenario in which the teach-back method is properly used. This will help dismiss any fears the patient is having, as well as clarify any uncertainty she has about the procedure. Let's look at how to handle this situation correctly.
We're good. Okay, Jill, so we took a look at your x-rays that we took, and you've got about 5 cavities going on. So that's a significant improvement from last time where you had like 6 to 10 of them. But we're looking at these x-rays, we see that your wisdom teeth are coming in and they're starting to look like they're getting impacted, and that's probably what's starting to cause you pain because they're crowding your other teeth.
Okay, wait a minute. I don't understand what my wisdom teeth even are or how they're wise, and I just got laid off and I just spent all my life savings paying for Bubba's business. Like I cannot afford to do this.
I'm sorry to hear about your job right now, but we have a plan that Kelly will talk about with you later after I kind of explain what's going on with your teeth. Is that alright with you?
Yeah, okay.
So your wisdom teeth are your last set of molars that come in usually, and they usually come in when you're an adult, so when you're 18 or so, but sometimes that happens a little bit later for other people. So most people have their wisdom teeth, some people don't, but you're just one of the lucky few like me and Kelly here have their wisdom teeth come in. And from looking at this x-ray, we can see that at least 2 of your 4 wisdom teeth are impacted. So we're going to have to get those out as soon as possible.
Whoa, what does impacted mean?
Impacted just means that your tooth is stuck underneath your bone in your mouth, so it can't get through. So that can cause crowding and pushing on the roots that are at the bottom, and it can cause an infection if we don't get those out of there, because food can get stuck.
Oh, okay.
Okay, Jill, I know that you don't have a lot of extra money to pay right away, so what we have available is a program called Care Credit. It's like a credit card, but you get to choose how much you want to pay each month, even if it's only $1. Does that sound like a manageable plan to you?
I can find 4 quarters a month. Like, I can for sure do that, but there's just no way that I can take off work. Like, Bubba just started his business, and it's just the 2 of us, and we're in season. There's no way that we can do this right now. I can't, if it's surgery, like she said, I don't have that kind of time.
I mean, we can wait if you want to, but in the end, it's going to be harder on you the longer we wait. Because like I said, it can cause infection, and that's what's pushing on your other teeth and making your other teeth hurt. So we only take 3 days of recovery time. So we could do it on a Friday if that would work better for you. That way you don't have to take 1 day off of work.
Okay, yeah. I mean, if I could get it on a Friday, then I could call Joe to cover for me, and Bubba could take me both. I could do through. I mean, yeah. Okay, I guess that's okay.
So what would happen on that Friday is that you'd come in pretty early. We'd get you here around 8 o'clock, and then we'd get an IV set in your arm. So we're gonna give you a sedative, just so you're pretty much asleep throughout the procedure. You won't remember anything that's going on.
Okay.
But if the IV doesn't work, we're going to give you an oral sedative, which is just a little pill that you take. And again, it's the same result of feeling sleepy. And that's why we need someone to come pick you up, drop you off, and take you home.
So that's why I need Bubba?
Yeah.
Okay.
Okay, so I will put you down for wisdom tooth extraction next Friday at 8 a.m.
Okay.
But we need to make sure that you have Bubba wait in the lobby for you, because you will be really sedated. And we want to make sure that you get home safely. So what are you going to tell Bubba whenever he asks why you have to miss work?
I'm going to tell Bubba that I have to get my 4 wisdom teeth extracted, and 2 of them are impacted, so they've got to put me out for it, and he needs to be here so he can pick me up and take me places, and Joe's going to cover for me. But I'm going to get it done on a Friday, so I only miss 1 day of work.
Great. And do you remember what the doctor said about the process?
She told me that I was going to get an IV in my arm, so I was going to fall asleep, and if they couldn't find the vein, then they were going to give me an oral sedative, and then they were going to take the teeth out, and once I woke up, Bub would be able to take me home, and it should only be like a 3-day recovery process. But I don't understand how I'm supposed to know when and how to take my meds.
That's a great question. We'll send you home with a paper explaining the procedure and then explaining your medication. After we get your fillings done today, we're also going to explain to you a little bit more about the medication. And then the morning that you come in, we'll go over it once again.
Oh.
Does that sound okay?
I mean, yeah, I feel so much better now. I thought you were going to take my whole mouth out or something. I feel good now. Okay.
All right. Well, we'll go ahead and get you laid back in the chair, and we'll go ahead and get those fillings done today, okay?
All right.
This was a fantastic way to handle the patient's uncertainty of upcoming procedures. The dentist, dental hygienist, and patient all achieved shared meaning on what they wanted to come out of the surgery and performing the surgery in the time frame set. The dentist and dental hygienist were also extremely empathetic, listened to the patient's questions, thought of alternatives for her, and answered all of her questions. The patient stated that she was relieved after having all of her questions answered and by being informed about the care credit. The care credit provides an opportunity for her to still be able to have the surgery done, but will not stress her out financially. This is important to note, as many patients do not have dental insurance. The teach-back method was effectively executed by having the patient explain to the dental hygienist what would happen during the surgery and what the dentist expected from her. Although it takes more time to use the teach-back approach, the patient was no longer uncertain and afraid for what was to come. A positive outcome would be expected after this encounter. In conclusion, we hope that you will be able to easily incorporate the teach-back method into your dental practice through patient education, discussion of diagnosis and treatment, as well as administrative tasks such as billing. The teach-back method not only ensures balanced information distribution to a patient, but also ensures that a patient fully comprehends the outcome of his or her appointment. By increasing the patient's knowledge, the teach-back method allows patients to autonomy in their health care. This method should reduce the uncertainty felt by many dental patients, leading to more positive health outcomes through continued preventative and restorative care. We encourage you to explore the benefits of the teach-back method further and consider making the method an integral part of your patient-provider interactions to help reduce the fear and uncertainty many patients have about their visit to the dentist.